Hello, my name is Daniel Contreras, and this is my outline called USA versus Drugs. In the United States, an estimated 5.7 million people had opioid use disorder. About 39.5 million people live with drug use disorders in 2021. To assess the US's drug problem, we have to go backwards in time to 1971. President Richard Nixon declared a war, not on a country, but on drugs. This was in response to the growing drug problem that the U.S. faced. And in the campaign that Nixon ran, he resonated the drug use with the growing number of crime that the U.S. faced. These efforts not only failed, but have led to other consequences that the U.S. and Mexico and North America in general still face today. As far as my credibility goes on this topic, I've been studying and, understanding the drug trade for the past 10 years as a Mexican kid. I've looked into it, and living in America, I've been told, that it is, one person's fault, but this relies, on the people who are dealing with it. Some of the main points that we'll be going over is that there's 3 points, and one of the points is that the U.S. has an internal drug problem. This is due to the over-prescribing of opioids, and one big problem that we had was Purdue Pharma. Another point, as we're going to go over, is that the U.S. has a demand issue. The U.S. is one of the highest drug consumers of any country in the world. And one of the last main points is going to be that the U.S. simply doesn't have the healthcare, or it has a rehab issue. So, to start from the beginning, like I said before, the U.S. has an internal drug problem. There's overprescribing of opioids that has been happening since, such opioids came out. A recent research shows that and indicates that 22% of initial opioid prescriptions were above the CDC's recommended limit, and 29% of opioid prescriptions for dental patients exceeded recommended limits. In another study done by for primary care providers, 3.8 of MDs, 8.0 of NPs, and 9.8 of PAs met at least one definition of overprescribing. While they're not the sole purpose of why this is happening, one other big reason that this has happened is due to Purdue Pharma, as far as exclusively the U.S. In 1996, Purdue Pharma released a drug named Oxycontin, and the drug somehow received FDA approval for being a miracle opioid that wasn't responsible for addiction or dependence. So we thought. Purdue Pharma and the drug Oxycontin caused a new age opioid epidemic which has killed over 450,000 people in the past 2 decades. This led to widespread addiction and overdoses. One study estimated that 65% of growth in overdoses death rates between 1996 and 2050 could be attributed to the introduction and marketing of Oxycontin. Per the CDC, approximately 105,000 people died from drug overdoses in 2023, and nearly 80,000 of those deaths involved opioids, so about 76%, more than half. This brings us to our next point, that due to those numbers and overprescribing, the U.S. unfortunately has a demand problem. The U.S. consumes the most out of any country when it comes to illicit drugs, and even prescription drugs for that matter. Unfortunately, the U.S. is a hot pot for smuggling due to the growing demand that we are facing due to the opioid epidemic, and it's caused dependency and problematic use, which causes users to eventually seek out other drugs and seek out things such as heroin, which are the same family of fentanyl and heroin. So it's just an ongoing cycle that's unfortunate. Estimates suggest that 3% and 19% of individuals exposed to opioids for medical reasons may develop chronic dependency or problematic use. So a one-day prescription carries a 6% chance of continued use at 1 year. An 8-day prescription increases the risk of 13.5, and a month-long prescription raises that risk to 30%, which is not feasible and can lead to just overall addiction to anyone who is prescribed anything for being hurt. So anything like that can just lead to some, downfall to so many people that just struggled with addiction. And overall, this leads to the lack of, care to public health. That contributes to the demand, and drug use can be, contributed and linked to economic hardship, lack of opportunity, trauma, and other social factors that create a demand for escape or self-medication, which brings us to the next point, that the issue is persistent, to public health. In many cases, demand remains due to the underlying economic, social, and mental health factors. Even when supply changes, the addicted are able to adapt as well. Sometimes go into stronger drugs. So people suffer due to these changes, and if they are able to seek help, who knows if they are going to be able to even go through with the help. Which brings me to my next point. The U.S. has a public health issue and doesn't cater to those who need help, from drugs, and make it harder, complicated. The U.S. Or the NCDAS has released a statement saying that rehab can cost anywhere from $5,000 to $80,000, making it less than ideal for someone who's on drugs. They typically economically struggle with trying to get any kind of help with that, which leads us to looking out for people that don't have services like that, such as mental health care. Mental health care also leads down to addiction, and that is something that we as America or the United States lack in funding as well. The U.S. struggles to address mental health, and according to the AAMC, access to care and treatment for mental health issues remains out of reach for most of the American population in the United States. Though more than 1/5 of U.S. adults, which is 21%, 52 million, had a mental illness in 2020. So, in another statement by them, they also state that from 2019, the number of adults aged 18 or older with any mental illness increased 3.8 million to 51.5 million. So that's nearly a 30% increase. So this is just, an ongoing, ripple effect from, addiction that has been caused internally by the U.S. But not only is it even a mental health problem, but it could also be, just a public health consequence, such as, drug overdoses and just, people not getting the proper care that they need for their mental health, and which leads them to continue abusing the drug. Opioid overdose deaths have been a major factor in the decline of overall U.S. life expectancy, and in recent years contribute to the role of bloodborne illnesses such as HIV and hepatitis C, HCV, as well as bacterial infections. So overall, this speech is kind of just to, outline and understand that the U.S. Does have an internal drug problem, and internal forces such as Purdue Pharma and, prescriptions that are, prescribed to us can sometimes, be our downfall. We will continue to have a demand issue as long as it's not taken care of by anyone higher than that. We also just have a public health issue. We don't, fund the proper things such as mental health or, bloodborne illness kind of research. So as long as the U.S. fails to fund these things to look out for people, then we can't expect a solution to be solved, a solution to, be had. This can save someone you love's life, or if this has impacted, someone you love's life, be aware that this war on drugs has contributed to numerous consequences for everyone involved. Instead of shifting the blame to other countries or blaming others for this, look at our own country and look at the people who are hurting and ask, can we help them? Thank you for listening. My name is Daniel, and that was my persuasive speech of war on drugs.